Can I just start by looking at the picture in the hospitals? We're constantly told that the pictures are overrun, that the hospitals are overrun, and any time that we're considering, for example, lockdowns, it's all centred around protecting the NHS. So what is going on in hospitals right now?
Yeah, so if we actually look at the facts and figures, we're nowhere near where we were this time last year. We've got around 5% of kind of beds in the NHS, the general and acute beds, are filled by COVID patients, and that's similar across the different nations. And it does kind of vary because the peaks of the different waves in different parts of the country were slightly different last year. So in England, the number of COVID patients about 60% lower. In Wales, it's actually 83% lower. And in Scotland, it's 50% lower. And for Wales and Scotland, the number of COVID patients is actually at a 3-month low. If we look at the picture then just for specifically critical care beds, where you kind of need more of that intense treatment, we know within England that about 1 in 5 COVID patients, 1 in 5 critical care beds have got a COVID patient in them, 3 in 5 have non-COVID patients, and about 1 in 5 of the critical care beds are unoccupied. So that's the general flavour. About 5% overall of beds. Critical care is about 1 in 5. But the narrative, obviously, across all of the general news that you start hearing is kind of the NHS is overrun with COVID patients. It's predominantly non-COVID patients that make up the majority of people in hospital.
Yeah, and then if I may, what is the kind of split here of the vaccination versus the unvaccinated, etc., when it comes to hospitalisations?
So what we do, Michelle, we get information each week from the UK Health Agency where they kind of break down the vaccination status of people who are admitted to hospital with COVID. Now, remember, about 1 in 4 patients who are admitted to hospital with COVID are actually in hospital with COVID, but they're not actually being treated predominantly for COVID, because obviously when COVID is spreading across the community, people will have that. And if we use the information that they've got, the most recent estimates would say that about 43% of the admissions with COVID for the last 4 weeks in England, for example, is people who are unvaccinated. And then we've also had a study recently done where they've linked the NHS number to the intensive care kind of units, and the researchers are on there, which says about 48% of patients who are in intensive care, the more serious care, are unvaccinated. And obviously we've been hearing ministers, lots of newspapers talk about 9 in 10 unvaccinated. You know, that's using a very small proportion of the kind of the population, which is a bit disingenuous when they're reporting it. So the majority of patients who are in hospital are vaccinated, but remember, the majority of people in the population are vaccinated. So it's not surprising. And the stats do show that if you are unvaccinated, if you compare 2 individuals, one who's got similar characteristics to another, that you're at a higher risk of admission if you are unvaccinated. But that's not the full story. There are other factors as well. We know that if people are obese, about half of the patients who are obese in intensive care. And interestingly as well is that if we look at severely obese, and this is using the NHS's own guidelines in terms of how you describe these, you've got over 4 times as many patients in intensive care as what you would expect if obesity had no impact on COVID admissions.
Yeah, and in terms of, because one of the things, Jamie, that we're always being told, and particularly in this conversation, I think that there is a real kind of sentiment that if you're not vaccinated, you are, deeply selfish because you're exposing yourselves to a greater risk of catching COVID and therefore transmitting COVID. Do we have any data around that?
Well, there's obviously the unvaccinated are put into kind of one big bucket at the moment. I've had 2 doses of a COVID vaccine. I've recently had COVID, and the Office for National Statistics, what they've done is looked at kind of the relative risk of catching COVID for different groups. And what we can see is that if you've had 3 doses, you've had your booster, you've had 3 doses of a COVID vaccine, if you compare those people versus somebody who's unvaccinated, there's an 80% reduction in the chance of you testing positive. And obviously, if you don't test positive, you're not going to transmit that on. But interestingly as well, if we start looking at people who've had a previous infection, so they've had COVID, and versus somebody who's never had COVID, there's a similar reduction in the chance of you catching it as well. So there will be many people who are unvaccinated who may have taken the decision not to have a vaccine because they've had COVID previously. And the facts and figures suggest they've got a similar level of not catching COVID as somebody who is kind of vaccinated as well. So I think, when you're talking about the unvaccinated population, Michelle, remember there's a large range of different people within there.
OK, Jamie Jenkins, thank you very much for that.